Every day you choose to move, your body responds with strength, balance, and renewed life. Each gentle motion is a gift to yourself, calm, mindful, and full of vitality. Together we move, we heal, and we thrive. Keep the rhythm of your golden years. Nurture health, cherish every movement. A detailed manual on fundamental exercises for individuals aged 60 and above. As global populations age, maintaining autonomy and ensuring a high quality of life in later years has emerged as a concern for both individuals and healthcare systems. Increasing data indicates that focused, regular physical activity is one of the most effective strategies for mitigating or correcting certain facets of age-related physical deterioration. Common beliefs sometimes associate exercise with intense gym workouts or specialized apparatus. Yet a limited array of simple functional movements, each readily executed at home, can provide significant enhancements in strength, balance, and cardiovascular health. These exercises are deliberately selected to target the physiological changes typically associated with aging, such as gradual muscle atrophy, diminished balance and proprioceptive abilities, and circulation modifications impacting the lower limbs. This booklet provides a comprehensive outline of a practical workout regimen designed for individuals aged 60 and above. The focus is on exercises that enhance leg strength, augment postural stability and balance, and promote healthy circulation. Consistent engagement in these exercises can reduce fall occurrences, maintain mobility for daily activities, and bolster the musculoskeletal, cardiovascular, and neurological systems essential for functional independence. The human body possesses a significant ability to adapt throughout life, and the application of consistent, suitably calibrated physical stimuli is the crucial factor that induces advantageous change. The subsequent sections analyze the physiological justification for each suggested activity, present explicit sequential instructions and progressions, and furnish advice on constructing a secure, sustainable training regimen that may be incorporated into daily activities. Comprehending the physiological necessities of aging. Before detailing specific workouts, it is essential to examine the primary physiological issues that these motions aim to address. Aging entails certain predicted alterations in anatomy and physiology, yet these should not be seen as unavoidable, irreversible mandates. Instead, they are processes that may be regulated and mitigated by organized physical exercise and prudent lifestyle decisions. Sarcopenia, the gradual decline of muscle mass. Sarcopenia denotes the age-related reduction in skeletal muscle mass and strength. Muscle mass commences its decline as early as the third decade of life, with the pace of deterioration generally intensifying post 60 years of age. The decrease in muscle tissue is not solely a cosmetic alteration, it directly impacts functionality. The leg muscles constitute the largest muscular groups in the body and are essential for maintaining an upright posture, making them typically among the most impacted. The functional repercussions encompass a reduced walking velocity, diminished stride length, heightened difficulty in rising from a chair or bathtub, and an increasing reliance on mobility aids. Leg strength is fundamental to daily mobility, such as walking, ascending stairs, and transitioning in and out of seats and beds, thus sustaining or reconstructing muscle through resistance and functional movements is essential for retaining freedom. Muscle tissue is metabolically active and has functions beyond force generation. It aids in glucose management, bone loading, which supports bone density and thermogenesis. Resistance and functional training enhance muscle protein. Synthesis augment neuromuscular coordination and may decelerate muscle atrophy. Even slight enhancements in lower limb strength result in significant advancements in daily functioning and diminish the likelihood of falls. Significantly, strength enhancements are attainable at nearly any age, as brain adaptations, enhanced motor unit recruitment, and coordination transpire rapidly with training and substantially contribute to initial progress. Equilibrium and proprioception, the mechanisms that preserve stability. Balance is a composite function reliant on three primary sensory systems. The visual system offers direction through sight. The vestibular system, located in the inner ear, detects head movement and spatial orientation, and the proprioceptive system consists of sensors in muscles and joints that relay information about body position to the brain. As one ages, the sensitivity and velocity of these systems, along with the reflex routes that interconnect them, frequently decline. Reaction times diminish, and the capacity to perform swift unconscious modifications for equilibrium maintenance is compromised. This is one reason why tiny disturbances, a rug edge, a puddle, or a curb, can result in falls that would previously have been readily mitigated. Falls rank among the primary causes of both fatal and non-fatal injuries in elderly individuals, often leading to skeletal fractures, diminished self-assurance, and a consequent decrease in activity that exacerbates physical deterioration. Balance training facilitates the retraining of neuromuscular networks, enhancing communication between sensory inputs and motor outputs, refining reflexes and fortifying the tiny stabilizer muscles essential for sustaining upright posture and recovering from disturbances. Balance training yields both immediate and enduring responses. Immediate enhancements typically indicate improved sensory integration and heightened concentration, but enduring benefits arise from reinforced, stabilizing musculature and more effective anticipatory postural adjustments. Engaging in balance exercises within more difficult environments, diminished visual stimuli, unstable terrains, or dynamic activities enhances resilience. As balance is a learned motor skill, intentional practice frequently results in swift and significant functional enhancement. Circulatory health. The function of the calf as the second heart. The circulatory system undergoes age-related transformations. The walls of veins may diminish in suppleness, and the unidirectional valves that inhibit backflow may become less efficient, heightening the propensity for blood to accumulate in the lower extremities. These alterations may present as edema, a sensation of weightiness pain, and the emergence of varicose veins. A significant vascular danger linked to diminished venous return is deep vein thrombosis (DVT), characterized by clot formation in a deep leg vein that may dislodge and migrate to the lungs, resulting in a pulmonary embolism. The calf muscles are essential in mitigating circulatory issues. Their contraction compresses deep leg veins and facilitates the upward movement of blood into the heart, functioning as a mechanical pump. The calf is often termed the body's second heart. Consistent engagement of the calf muscles through basic workouts significantly enhances venous return and mitigates the risks of associated problems. Besides acute circulatory advantages, consistent calf activation enhances local muscular endurance, ankle flexibility, and gait propulsion, hence facilitating a more effortless and efficient walking experience. Individuals who remain seated for extended durations, such as during travel or desk work, can mitigate venous stasis and enhance long-term vascular health by intermittent calf contractions and ankle movements. Cognitive and neurological advantages of physical activity. Physical activity not only enhances muscular and circulatory function, it also promotes cognitive wellness. Tasks that test coordination and balance necessitate intricate connections among the brain peripheral nerves, muscles, and joints. This involvement activates brain circuits and enhances both functional connectivity and cognitive processing. Studies repeatedly demonstrate that older persons participating in regular physical activity, incorporating coordination and balance elements, frequently have enhancements in memory focus and cognitive clarity, while also exhibiting a reduced risk of acquiring serious neurodegenerative diseases. Engaging in practice and learning movements enhances cognitive functions such as pattern recognition, motor planning, and attention, while the augmented blood circulation from exercise delivers oxygen and nutrients to the brain, promoting cellular health. Exercise diminishes risk factors for vascular cognitive impairment, hypertension, insulin resistance, obesity, and dyslipidemia, thereby indirectly safeguarding cognitive function. The social dimensions of exercise, such as group sessions and strolling with friends, enhance mental health and mitigate isolation, a factor associated with cognitive decline. Tasks necessitating dual engagement, such as maintaining balance while verbalizing a list, can be very efficacious in concurrently enhancing cognitive and motor skills. A regimen of 5 fundamental exercises. The subsequent 5 exercises constitute a fundamental at-home regimen targeting the primary requirements of older adults, lower limb strength balance, and proprioception and circulatory support. None of these exercises necessitates specific apparatus. Every movement can be adjusted to correspond with an individual's existing fitness level and any medical restrictions. Universal principles, applicable to all exercises. Initiate at a measured pace and advance incrementally. Facilitate sufficient recovery for exercises involving increased load. Prioritize the quality of movement rather than the quantity. Regulated movement diminishes joint strain and the likelihood of damage. Utilize a sturdy surface and supportive footwear for tasks requiring prolonged standing. In the event of pain, dizziness, chest discomfort, or atypical symptoms, cease activity and seek advice from a healthcare expert. Consider including basic equipment resistance bands, ankle weights, or a step to enhance intensity as strength develops. Engage in a warm-up prior to and a cool-down following sessions to mitigate injury risk and enhance comfort. Maintain a log of workouts, sets, repetitions, and any symptoms to track progress and inform modifications. 1. The squat restoring fundamental strength. The squat is acknowledged as a very efficient functional exercise due to its near resemblance to the common actions of sitting and standing. This complex movement engages many muscle groups, simultaneously rendering it an effective option for enhancing lower body strength, which facilitates safer and more effortless execution of daily chores. The squat predominantly fortifies the quadriceps, gluteus maximus, and hamstrings, while also engaging the core and lower back muscles for stability. By fortifying these muscles, the squat directly mitigates sarcopenia and enhances the ability to do tasks such as rising from a low seat, stepping onto curbs, lifting light objects from the ground, and ascending stairs. Robust legs provide the strength and stability essential for autonomous movement and diminish the probability of reliance on walking assistance. Comprehensive guidelines and adjustments. Chair-assisted squat novice. Set up, position yourself in front of a stationary chair without wheels, with feet approximately shoulder width apart and toes slightly angled outward. Position the chair to allow for a relaxed seating posture. Movement initiate by retracting the hips as though preparing to assume a seated position. Flex both knees and descend with precision until the hips gently contact or approach the chair. Elevate the chest, retract the shoulders, and sustain a neutral spinal alignment. Prevent the knees from converging inward. Apply pressure through the heels and mid-foot to achieve full standing. Instructions. Recline, do not descend. Maintain weight on the heels. Elevate the chest. Progression. Gradually diminish dependence on the chair over several weeks by merely lightly contacting it or eliminating it once assured. Sit to stand functional variation. Setup. Position yourself at the front edge of a robust chair with your feet flat on the ground and shoulder width apart. Movement. Cross the arms over the chest to inhibit the use of momentum. Lean slightly forward, engage the core and exert force via the heels to achieve an upright position. Maintain composure when seated. Practical advice. This pattern emulates daily activities and is especially beneficial for enhancing autonomy in transfers. Wall squat and partial squat intermediate level. Position. Stand with your back against a wall or slightly away from a countertop. Feet positioned at hip width. Movement. Execute a half squat to a comfortable depth, approximately 45 degrees of knee flexion, ensuring that the knees align over the toes and do not extend excessively beyond them. Maintain a brief pause, then ascend. Advantage partial squats diminish knee compressive forces while effectively engaging the extensor muscles. Tempo and isometric variations. Advancement. A reduced speed 3 to 4 seconds. For lowering 1 to 2 seconds, for holding 2 seconds, for rising enhances time under tension and muscular control. Incorporate brief pauses at the conclusion, or execute slow, eccentric-only repetitions to enhance strength targeting. Incorporate light resistance, such as a resistance band positioned above the knees, light hand weights, or a backpack with a moderate load when bodyweight exercises become effortless. Sophisticated functional difficulties. Box squat's methodical descent to a lower platform. Goblet squat with a modest weight secured at the chest if approved and safe. Step-ups refer to the progression section as a functional adjunct. Frequent errors and amendments. Knees deviating medially. Focus on externally rotating the knees. Enhance hip abductor power through lateral leg lifts and clamshell exercises. Elevating onto toes. Signal to exert pressure through the heels. Assess foot alignment and allocate weight evenly over the heel and midfoot. Rounding the back. Sustain an elevated chest and activated core. Utilize a mirror or input from a caregiver. Rapid descent. Decelerate the lowering phase to maintain joint stability and muscle activation. Suggested frequency and volume. Due to the taxing nature of squats, as a strength exercise training every other day, about 3 times per week, facilitates sufficient recovery and muscle rebuilding. Strive for 2 to 3 sets of 8-15 repetitions every session, contingent upon capability, utilizing greater repetitions for muscular endurance and fewer repetitions for strength. Modify load and depth to ensure the task remains suitable. If the final repetition lacks difficulty, contemplate raising depth, reducing pace, or including resistance small dumbbells or a resistance band around the thighs. 2. The calf raise, engaging the second heart. Calf raises appear uncomplicated, yet provide significant advantages for lower leg circulation and ankle stability. Calf raises activate the gastrocnemius and soleus muscles, hence stimulating the venous pump mechanism that aids in venous return to the heart. Primary benefits. The foremost circulatory advantage of calf raises is enhanced venous return from the lower extremities, which aids in diminishing swelling, mitigating venous stasis, and reducing the chance of varicose vein formation and deep vein thrombosis (DVT). Robust calf muscles stabilize the ankle joint, reducing the likelihood of sprains and improving push-off during ambulation. Enhanced propulsive strength leads to increased walking endurance and less perceived fatigue during daily ambulation. Comprehensive guidelines and adjustments. Standard supported calf raise. Position: stand facing a wall countertop or the rear of a robust chair for minimal support. Feet positioned parallel and at hip-width distance. Movement: gradually elevate onto the balls of the feet to raise the heels from the ground. Pause momentarily at the apex to experience the constriction, then descend with control. Refrain from bouncing. Tempo 2 seconds ascending, 1 to 2 seconds break, 2-3 seconds descending. Intermediate single leg calf raise. Setup. Position yourself near a support and elevate one foot slightly. Maintain a pliable, supportive knee. Movement. Elevate onto the forefoot of the supporting leg for a complete contraction, then descend gradually. Execute the set on one side, then transition. Advantage: disrupts equilibrium and increases the burden on each calf twofold. Advanced step or stair. Calf raise. Setup. Position yourself with the balls of both feet on the edge of a step, allowing your heels to descend below the level of the step. Movement. Descend the heels into a stretch, then contract to elevate the heels to the maximum height. Progression. Incorporate light handheld weights or a moderately weighted backpack for further effort. Seated calf raise for extended sitting or restricted standing. Position: sit with feet flat on the ground and knees at a 90-degree angle. Movement: elevate heels while maintaining toes on the ground, sustain briefly, then descend. Perform in intervals throughout the day. Application beneficial during travel or for individuals with restricted standing endurance. Frequent errors and amendments. Employing momentum. Gradual controlled repetitions are optimal for enhancing venous pumping and muscular activation. To get a complete range of motion, utilize a step to safely enhance range if ankle mobility permits. Maintain a modest bend in the knee to sustain tension on the calf muscle, particularly while employing a straight leg stance. Suggested frequency and volume. Calf raise training largely enhances circulation rather than significantly increasing muscular mass, making it suitable for daily execution. Strive for 2 to 4 sets of 10 to 25 repetitions daily spread throughout the day, if beneficial. Individuals experiencing edema after extended periods of sitting may find mini-sets every 30 to 60 minutes especially advantageous. Incorporating calf lifts into daily routines, such as when waiting for the kettle during television commercials or while brushing teeth, enhances compliance and cumulative advantages. 3. Unipedal posture. Refining the equilibrium mechanism. The single-leg posture presents a concentrated challenge to the body's equilibrium mechanisms. Narrowing the base of support necessitates the integration of visual, vestibular, and proprioceptive inputs while enhancing the muscles and reflexes essential for maintaining equilibrium. The primary advantages of single-leg balance practice are improved proprioception, enhanced stabilization of the ankle and hip joints, and refined reflexive reactions to perturbations. These enhancements closely correlate with a diminished risk of falls in daily situations, navigating uneven surfaces, maneuvering through busy areas, or regaining balance after a stumble. Consistent practice enhances confidence in one's capacity to navigate securely. Comprehensive guidelines and adjustments. Assisted single-leg stance novice. Set up, position yourself adjacent to a wall stair railing or robust table and rest one hand gently on the support. Movement, transfer weight onto one leg, elevate the opposite foot a few inches above the ground, maintaining a slight bend in the standing knee. Concentrate on a stationary spot at eye level. Maintain for 10 to 30 seconds. Progression. Gradually decrease hand pressure from full palm contact to fingertips, ultimately achieving no contact. Unsupported single-leg stance, intermediate level. Movement. Maintain an unsupported standing position for up to 60 seconds or execute many repetitions of single-leg stands lasting 10-20 seconds each. Variations. Adjust the position of the free foot in front, behind, or slightly crossed to alter the level of difficulty. Single-leg stance with eyes closed, advanced. Action. Temporarily close eyelids to eliminate visual stimuli. Commence with brief holds 3 to 5 seconds and progressively extend the duration. Always guarantee that support is within arm's reach. Dynamic unilateral tasks. Advance to subtle head rotations extending across the body, or catching, throwing a lightweight ball while balancing on one leg to enhance reactive balance and dual task capability. Frequent errors and amendments. Stabilizing the hip, retain a small flexion at the hip and knee to accommodate mild disturbances. Breath retention. Maintain a steady breath. Holding the breath elevates tension and may induce instability. Compensatory trunk leaning. Maintain alignment by fortifying hip abductors. Utilize a mirror if necessary. Overtraining. Balance training emphasizes skill development. Brief, regular practice typically produces superior results compared to prolonged, exhausting sessions. Suggested frequency and volume balance is a motor ability that enhances with consistent practice. Strive for balance exercises 3 to 5 times weekly, including several short standing in each session. Quality supersedes duration. Execute multiple brief, concentrated holds instead than one extended, unfocused effort. Incorporate balance exercises after a brief warm-up when focus is at its peak. 4. The glute bridge. Hip raise. Fortifying the posterior chain. The glute bridge is an efficient floor exercise for fortifying the gluteal muscles and hamstrings, the posterior chain often weakened by extended sitting and inactivity. Key advantages. Robust gluteal muscles are essential for pelvic stability and safeguarding the lower back. Deficiency in this area leads to a forward flexed posture, diminished walking efficiency, and persistent lower back pain. The glute bridge fortifies the hip extensor muscles, enhancing posture, reducing lumbar strain, and augmenting power for ambulation stair ascent and transitioning from a seated position. It enhances the squat by targeting the posterior musculature and fostering balanced lower limb strength. Comprehensive guidelines and alternatives. Conventional glute bridge. Position. Recline on your back on a solid surface with knees flexed and feet flat aligned at hip width. Arms repose adjacent to the torso. Action. Activate the core and gluteal muscles. Apply pressure with the heels against the floor to elevate the hips until a straight line is formed from the shoulders to the knees. Refrain from hyperextending the lumbar region. Constrict the gluteal muscles at the apex for 2 to 3 seconds, then descend gradually. Instructions: engage the heels. Contract the gluteal muscles at the apex. Isometric glute bridge with sustained hold. Movement. Maintain the apex position for 10-30 seconds to enhance endurance and hip stability. Glute bridge march unilateral stability. Movement. From the elevated bridge position, elevate one foot and flex the knee towards the chest, alternating legs in a marching sequence while sustaining a neutral pelvis. This tests unilateral control and core stability. Elevated bridge or single leg bridge. Advanced. Movement: position one foot on an elevated platform or extend one leg fully during the bridge to augment the load on the engaged glute. Execute with caution and just when mastery is exceptional. Frequent errors and amendments. Arching the lower back. Ensure the glutes perform the majority of the effort. Visualize a tiny tuck of the tailbone at the apex. Engage the toes. Maintain weight in the heels to activate the glutes instead of the quadriceps. Accelerated descent. Regulate the drop to sustain muscular engagement and safeguard the lumbar spine. Suggested frequency and volume. The glute bridge can be executed 2 to 4 times weekly with 2 to 3 sets of 8 to 15 repetitions or isometric holds lasting 10 to 30 plus seconds. Bridges are low-impact exercises that are appropriate for anyone who cannot endure standing strength training. 5. The side leg raise, standing hip abduction, ensuring lateral stability. The side leg raise engages the hip abductor muscles, particularly the gluteus medius located on the lateral side of the hip. These muscles are essential stabilizers of the pelvis and ensure level hips during single-leg support phases of ambulation. The primary benefits include the prevention of pelvic drop on the unsupported side during ambulation, a phenomenon termed Trendelenburg gait, which diminishes walking efficiency and may exacerbate hip and lower back pain. Fortifying these muscles boosts lateral stability, optimizes gait mechanics, and safeguards the hip and knee against atypical stressors. Comprehensive guidelines and adjustments. Assisted lateral leg elevation. Set up: position yourself along a wall or a robust chair for hand support, maintaining an upright posture with feet together and core activated. Movement. Maintain an erect torso and level hips while laterally elevating the outer leg to a height attainable without inclining the trunk. The movement should initiate at the hip rather than from the foot or torso. Pause momentarily at the apex, then descend with precision. Complete all repetitions on one side prior to transitioning. Instructions. Initiate with the heel. Maintain a level pelvis. Isometric side leg raise with hold. Movement. Maintain the elevated leg at the apex for 5 to 10 seconds to enhance endurance in the abductor muscles. Prone abduction seated or supine variation. Position: recline on your side and elevate the upper leg. This modification diminishes the requirement for balance and is beneficial for individuals with standing constraints. Frequent errors and amendments. Trunk inclination. If inclination occurs, reduce range of motion or enhance core strength. Utilize mirror feedback. Rotate the hip. Ensure the toes remain directed forward to achieve true abduction. Employing momentum. Elevate and descend gradually to highlight muscular control. Suggested frequency and volume: execute side leg lifts 2 to 3 times weekly with 2 to 3 sets of 8-15 repetitions per leg, emphasizing deliberate controlled movement and preserving pelvic alignment. Establishing a secure and sustainable routine. Comprehending the workouts is a crucial initial stage. Nevertheless, regular and safe practice is what produces enduring advantages. The notion of progressive overload incrementally enhancing the intensity, duration, or complexity of exercises applies in this context, however. It must be harmonized with adequate recovery, proper technique, and individual health considerations. Exemplary weekly itinerary. Comprehensive presented below are two exemplar schedules, one conservative for novices and another for persons with average fitness levels seeking expedited advancement. Modify frequency and amplitude in accordance with recuperation, exhaustion, and medical advice. Initial schedule, 2 to 3 weeks to establish a regimen. Monday, strength and circulation. Chair-assisted squats, 2 sets of 8 to 10 repetitions. Glute bridges, 2 sets of 8 to 12 repetitions. Supported calf raises, 2 sets of 12 to 15 repetitions. Concise post-exercise stretching hamstrings, calves, gluteal muscles. Tuesday, equilibrium and mobility. Assisted single leg stance, 3 holds per leg. 10-20 seconds. Side leg raises standing, or supine, 2 sets of 8-10 repetitions each side. Ankle rotations. Mild hip mobility exercises. Wednesday, active recuperation. A leisurely walk or seated riding for 15 to 25 minutes. Intermittent seated calf raises. Thursday, emphasis on strength, sit to stand. 2 sets of 8 to 12 repetitions. Glute bridge holds, 2 holds of 10 to 20 seconds. Calf raises, 2 sets of 12 to 15 repetitions. Friday, balance and functional. Balance exercises, supported single leg stance with head rotations. 3 repetitions per leg. Lying abductions, 2 sets of 8 to 12 repetitions. Saturday. Optional. Mild leisure pursuits. Horticulture. Extended ambulation. Sunday rest or light activity. Rest or gentle movement and respiratory exercises. Intermediate schedule after 6-12 weeks contingent upon comfort level. Monday strength training. Perform squats or partial wall squats, 3 sets of 8 to 12 repetitions. Glute bridges with a march, 3 sets of 10-12 repetitions. Calf raises on a step, 3 sets of 12 to 20 repetitions. Tuesday, equilibrium and lateral stability. Unsupported single leg stance, 3x5 holds per leg duration of 20-45 seconds. Side leg raises with isometric hold, 3 sets of 10-12 repetitions per leg. Dynamic equilibrium activities, ball catching. Wednesday, cardiovascular exercise. A 20 to 40 minute session of walking, cycling. Or aquatic aerobics, Thursday strength training, squats with tempo variations, 2 to 3 sets of 8-12 repetitions, single leg bridge or elevated bridge, 2 to 3 sets of 8 to 10 repetitions, single leg calf raises, 2 sets of 10-12 repetitions per leg. Friday, equilibrium and agility. Single leg progressions with eyes closed, lateral stepping exercises, exercises for hip and ankle mobility. Saturday, day of active recreation, hiking, extended walking, dance class, or movement-based social activity. Sunday, rest and recuperation, mild stretching foam, rolling self-myofascial release. Advancement protocols. Weeks 1-4. Develop technique and maintain consistency. Commence with assistance and a modest load. Employ fewer repetitions while maintaining proper technique. Weeks 5 to 12. Gradually augment repetitions, depth range, or duration of holds. Commence single leg variations and incorporate light resistance band ankle weights. Months 3 to 6. Introduce complexity alterations in pace, step-up progressions, diminished visual input, and integrated functional activities, transporting things while executing step-ups. Continuously evaluate objectives and progressively enhance difficulty, increased resistance, extended balance, holds incorporation of cognitive tasks during balancing activities or elevated step height. Assessing advancement and establishing objectives. Objective indicators. 30-second chair stand test. Count of complete stands from the chair within 30 seconds. Timed up and go. Tug stand traverse, 3 meters. Pivot return and sit duration recorded. Single leg stance. Maximum duration of unsupported standing on one leg. 6-minute walk test, distance traversed in 6 minutes as an indicator of endurance. Functional objectives. Safely exit the bathtub. Walk to the nearby store without undue fatigue or transport groceries up one flight of stairs. Maintain a straightforward log to document workout type sets, repetitions, duration of holds, and perceived exertion. Re-evaluate every 6 to 12 weeks. Acknowledge incremental accomplishments, additional repetitions, extended single-leg holds, deeper squats, or diminished dependence on hand support. Warm-up and cool-down details. Warm up 5-10 minutes. March in place or engage in slow walking for 2-3 minutes to gradually boost heart rate. Ankle rotations, 10 repetitions each side in both directions. Perform hip circles or marching with hip lift, 10 repetitions per side. Perform 10 arm circles and 10 shoulder rolls to facilitate upper body mobility. Gentle seated or standing leg swings forward and backward. 8-10 repetitions per side within a comfortable range. Dynamic calf pumps, minor heel elevations to activate the venous pump. Cool down and stretching, 5 to 10 minutes. Calf stretch 30 seconds on each side, either standing or utilizing a step. Hamstring stretch 30 seconds on each side, sitting or supine. Quadriceps stretch 20-30 seconds on each side, standing with assistance. Hip flexor stretch 20-30 seconds on each side, lunge posture with assistance. Perform gentle spinal twists or the cat-cow pose while on hands and knees if comfortable. Respiration. Rhythm and movement. Excellence. Breathe naturally. Inhale during the lowering stages and expel during exertion. Refrain from performing the Valsalva maneuver, forceful breath holding, particularly if hypertensive or suffering from cardiac disease. Execute movements with a regulated tempo, 2-4 seconds for the eccentric phase, lowering a brief pause, followed by 1 to 2 seconds for the concentric phase, lifting unless a specific tempo is indicated. Strive for seamless transitions and complete focus on alignment. The quality of movement diminishes joint tension and enhances neural learning. Apparatus and basic instruments for secure advancement. Robust chair devoid of casters. Resistance bands mild to moderate. Ankle weights begin with 0.51 kilograms and advance judiciously. A secure platform or a low step for calf raises and step-ups. Anti-slip workout mat. Lightweight dumbbells or water bottles for increased resistance. Supportive footwear featuring a non-slip sole, grasping bars or rails for balance enhancement. Exceptional conditions and adjustments. Pre-existing conditions and post-surgical considerations. Joint replacement adhere to the directives of the physician and physiotherapist following hip or knee replacement surgery. Initial post-operative sessions focus on moderate range of motion and isometric activation, advancing to weight-bearing functional tasks when permitted. Refrain from executing quick or ballistic motions in the initial stages. Severe osteoporosis, refrain from intense spinal flexion and high-impact loading activities. Concentrate on regulated strength and balance training. Seek the expertise of a specialist to formulate a secure program prioritizing proper posture and safe loading techniques. Cardiovascular disease, secure medical authorization. Assess effort utilizing the Borg rating of perceived effort target moderate intensity, generally 11 to a 13, on a 6 to a 20 scale, and be vigilant for chest pain, pronounced dyspnea, lightheadedness, or vertigo. Understand target heart rate zones, if recommended by a healthcare professional. Arthritis. Utilize pain as a reference. Restrict uncomfortable ranges, implement clinician-recommended anti-inflammatory measures, and emphasize low-impact exercises such as bridges and partial squats. Modifying pace frequency and depth frequently alleviates joint inflammation. Peripheral neuropathy or sensory loss. Highlight observable safety precautions, secure support, appropriate footwear, and oversight due to potentially diminished proprioceptive feedback. Incremental balance difficulties and tactile prompting can be beneficial. Parkinson's disease. Collaborate with a physical therapist to develop cueing tactics that enhance gait and facilitate step start. Integrate cadence and external rhythm metronome music into ambulation and practice weight shift exercises. Stroke survivors. Tailored programs are essential. Emphasize symmetry-secure transfers and monitored strength training to mitigate hemiparesis. Referral to rehabilitation services is frequently necessary. When to cease and pursue medical assistance. Cease exercise immediately if you encounter chest pain or pressure, inexplicable dyspnea, syncope or near syncope, acute severe joint pain, or pronounced asymmetrical limb swelling. Pursue immediate medical attention for suspected deep vein thrombosis, calf discomfort, edema, increased warmth, erythema, or symptoms indicative of cardiac events. If dizziness or vision disturbances continue after cessation, pursue medical assessment. Fall prevention strategies beyond physical exercise. Home modifications, secure rugs, ensure level thresholds, put grab bars in bathrooms, enhance lighting, and eliminate clutter and trailing cords. Footwear, utilize properly fitting shoes with non-slip soles. Refrain from high heels and ill-fitting slippers. Consider footwear with rocker soles if ambulation discomfort is a concern after expert consultation. Assistive equipment, utilize canes or walkers as directed. Verify that gadgets are properly adjusted and in satisfactory condition. Vision and auditory assessments diminished. Sensory perception elevates the danger of falls. Consistent evaluations and rectifications are essential. Medication evaluation. Some drugs may exacerbate dizziness or orthostatic hypotension. Consult your clinician or pharmacist for assessment. Incentives, compliance, and social tactics. Establish modest, attainable objectives and commemorate milestones. Implement a buddy system by exercising with a companion family member or participating in a group class. Incorporate exercises into regular activities, calf lifts while waiting for the kettle sit to stands during television commercials. Maintain a conspicuous calendar or checklist to indicate completed sessions. Explore community programs, SeniorFitness courses, or monitored sessions with a physical therapist for accountability. Alternative activities to sustain engagement, dance lessons, gardening, swimming, or Tai Chi enhance strength and balance training. Frequently asked troubleshooting inquiries. What is the anticipated timeline for improvement? Many individuals observe enhanced stability and reduced exertion in tasks within 4 to 8 weeks. Strength and muscle adaptations persist progressively over several months with persistent training. What should I do if I experience soreness after exercising? Mild delayed onset muscle soreness, DOMS, frequently occurs while commencing new exercises. Engage in light exercise, perform modest stretching, and apply heat or cold as necessary. If pain restricts functionality or is acute and atypical, cease activity and seek professional advice. What if I am excessively fatigued? Reduce intensity and frequency, prioritize rest and nutrition, and seek clinical advice if weariness is extreme or inexplicable. Is it possible to integrate this with aerobic exercise, walking, cycling, or swimming, enhance these strength and balance activities, and further augment cardiovascular health? Plan aerobic exercise on the same day or on alternate days contingent upon recovery. Is it typical for balance exercises to be challenging? Indeed, equilibrium necessitates both practice and vigilance. Concise, targeted sessions frequently yield superior results compared to prolonged, unfocused ones. Travel and environmental adjustments. During travel days or flights regularly, do sitting calf lifts and ankle circles to sustain venous return. Utilize hotel room amenities, sturdy chairs, counters to execute brief strength or balancing exercises. Include a resistance band for convenient advancement alternatives. Schedule brief walking intervals during extended drives or flights to alleviate stiffness and prevent venous stasis. Fundamentals of nutrition. Hydration and recovery. Protein consumption facilitates muscle recovery. Target approximately 1.0–1.2 kg of body weight daily as a general recommendation for older persons participating in resistance training, excluding contraindications due to renal disease. Seek guidance from a dietitian for personalized recommendations. Allocate protein intake evenly throughout meals 20-30 each meal to optimize muscle protein synthesis. Maintain hydration prior to and following physical activity to enhance circulation and healing. Older persons may experience a diminished thirst response. Establish reminders to consume water consistently. Sufficient sleep, 7 to 9 hours for the majority of people, facilitates recuperation and the neurological consolidation of motor learning. Optimize protein consumption within 1 to 2 hours post-exercise for optimal recovery, and consult a healthcare professional regarding supplements if food intake is inadequate. Collaboration with caregivers and professionals. Caregivers can facilitate by creating secure conditions, aiding in preparation, and offering encouragement and oversight as necessary. Physical therapists do personalized evaluations, gait assessments, and customized rehabilitation plans for intricate conditions or post-surgery. They also instruct caregivers in safe transfer methods. Primary care providers can assess cardiovascular risk and grant medical clearance through risk stratification. Monitoring documentation and timing for reevaluation. Maintain a concise log date. Exercises, executed sets, repetitions, hold durations, perceived effort, and any symptoms experienced. Reevaluate function every 6 to 12 weeks by measuring walking distance, conducting the timed up-and-go test, or assessing single-leg stance duration to inform progression decisions. If no discernible progress occurs after 6 to 12 weeks despite compliance, seek expert assessment to optimize the program or explore potential limiting variables, nutrition, sleep, prescription side effects, medical comorbidities, supplementary practical illustrations, and case annotations. Example 1. A 68-year-old novice exerciser with minor knee osteoarthritis commence with chair-assisted squats, sit-to-stands, glute bridges, and seated calf lifts. Utilize a resistance band encircling the thighs for little hip strengthening instead of substantial standing weights. Advance to brief ambulations and incorporate unsupported single-leg balance with a chair for support. Example 2. A 75-year-old individual with well-managed hypertension and satisfactory baseline fitness levels initiate a regimen of 2 strength training sessions and 3 balance training sessions. Weekly integrate single-leg calf raises and single-leg bridges and include 30-40 minutes of moderate walking on alternate days. Assess RPE and blood pressure responses during initial sessions. Example 3. An 80-year-old individual with peripheral neuropathy and sensory deficits. Prioritize safety, provide handheld support, guarantee sturdy footwear, and involve a caregiver for initial balance exercises. Employ seated and supine strength exercises, such as bridges and seated leg lifts, before progressing to standing activities as proprioception enhances. Final assessment. The journey of aging is something we all share, but how we move through it is entirely within our control. The 5 simple exercises you've just learned, squats, calf raises, single leg stances, glute bridges, and side leg lifts, aren't just movements. They're the foundation of confidence, balance, and freedom in your golden years. With just a few minutes of consistent practice, you can strengthen your legs and hips, improve your circulation, boost your balance, and reclaim the independence that keeps life vibrant and enjoyable. Remember, you don't need fancy equipment or long hours at the gym, just commitment, correct form, and a gentle, steady rhythm each day. If today's video inspired, you don't forget to like, share, and subscribe to our channel to stay updated with more practical science-backed exercises designed especially for older adults. And while you're here, make sure to check out the other videos in this playlist. Each one is a step toward a stronger, healthier, and happier you. Thank you for watching. Stay active, stay positive, and take good care of your body. It's the only place you have to live. Wishing you strength, balance, and radiant health every day. Every day you choose to move your body responds with strength, balance, and renewed life. Each gentle motion is a gift to yourself, calm, mindful, and full of vitality. Together we move, we heal, and we thrive. Keep the rhythm of your golden years. Nurture health, cherish every movement.